Hello there, I'm Jeff Trammell. I'm one of the service line clinical supervisors here at Surgical Specialties. I have been a nurse in SICU and now 7 West for 12 years now, and I've spent my whole career here at University Hospital. Today you're going to be watching a video here on how to use the Belmont Rapid Infuser. This is one of those pieces of equipment that can literally save your patient's life if you know how to work it appropriately. So we're going to take a little time and talk about how to use it, when to use it, and how to use it the most effectively. All right, so the docs have told you that we need to use the Belmont. So the first thing you're going to need to find is the Belmont tubing and then extension tubing, which are in the supply room. It's important that you get the extension tubing because the Belmont tubing is fairly short in the section that connects to the patient, and also because giving yourself a little space between the patient and the Belmont allows for a little more room to maneuver should there need to be multiple people at the bedside, which there often are when you're doing a mass transfusion. So this is the actual Belmont tubing, and this is the extension tubing, which will be in the supply room right next to it. All right, so as we talked about, the Belmont is Belmont is a brand of rapid infuser. Rapid infusers, as we mentioned before, are one of the pieces of equipment that we use that can literally save a patient's life if it's used appropriately. One of the first things you'll need to do when you get it is plug it into the wall and then turn on the power, which the power switch is on the back here. You'll see it right here. So push it and hold it down, and then you're going to wait for the screen to kind of kick on. So machine's turned on, door is closed, and if you look on the screen here, it kind of gives you a brief 1, 2, 3, 4, 5, 6 step instructions for how to appropriately load the Belmont, the infusion set, the tubing, which we're going to do here in just a second. But this is what the screen will look like when you first turn it on and when it doesn't have tubing in it already. All right, so just a brief tour of the innards here when you open the door up, and then we'll go over how the tubing fits into it here in a second. But if you just take a look here, so this little chamber here and the accompanying groove is where the actual air detector is. So if you have air bubbles in your tubing, it will be detected there. This is a safety valve. This right here is where the tubing will exit to go to the patient. This big circle right here is just a heating element. That's all this is. This circle heats the blood or the fluid that's going through your rapid infuser. And then over here, this piece with the wheels on it is the actual pump. This is what will actually turn to push the blood or saline through this machine and out to the patient. This is some Belmont tubing we use for education, so normally it'll be packed a little neater than this. This one's been used a couple of times already, so be aware that when it comes out of the package, it'll be a little less of a mess. But anyway, so the first thing you're going to do is peel this open and take all of your tubing out of here. Okay, and I know that looks like a tangled mess, but if you'll look here, you can see that the tubing inside the Belmont is color-coded for where the various tubes need to run. So in my opinion, the best way to start is to go ahead and take this piece right here and clip it in to get it up out of the way. And it'll need to be low enough so that this clip right here can fit into this groove, okay? This clip here fits into this groove right above the pump. It has an arrow on the top that shows you the direction it needs to be pointed, a little blue arrow on the top. So that goes in here, okay? And then if you look, red goes to red. So I'm going to put my heating element right here in the middle, follow the red tubing all the way around until it gets to here. You have these two little pieces split here, okay? This piece goes on this side of the little safety clip because this is where it's actually going to go to the patient. This piece goes on the inside, and if you can see, skinny line, fat line, skinny line, fat line. You're going to follow this along. Your fat line goes right here, okay, and goes over your pump. This is what it should look like when it's loaded appropriately. But now that you have all the tubing loaded in here appropriately, I'm going to close the door and I'm going to latch it. All right, so as with any blood transfusion, it's important that the only fluid you prime your tubing with should be normal saline. You could use LR in the Belmont, but not if you're going to use it for blood transfusions, only if you were just doing a fluid transfusion. All right, so if you notice our tubing here, you've got 2 long and 1 short. Blood bags and product bags are usually smaller and shorter than a liter bag. So these 2 longer tubes are for your product. The shorter tube here is going to be for your saline. So I'm going to go ahead and pull my tab here and spike my bag of saline. So if you can see the screen here, Now that we have our bag attached, there's a little button here that says prime. I'm going to hit the prime button and let it run. Gurgle, gurgle, you can hear it priming. Yeah. So if you notice on top of this little piece here, there's a little one-way valve here. You'll notice there's a lot of air in the tubing as it's being primed. This little one-way valve here is going to let that extra air be expressed out without having to redo the entire set of tubing. Okay, now if you look down at the screen here, it says it's primed, but that just means that the Belmont has primed to this little blue clip down here, okay? You're gonna need to prime this piece here, which is the patient line. So I'm gonna hold down prime patient line. Chug-a-lug. All right, now here we go. The patient line is primed. You can now attach this to the patient. And if you look here, it says patient line primed. The next step is you're going to hit this button that says infuse. Okay, so the patient line is primed. Hit the button that says infuse. This is the screen that's going to pop up. Okay, this is the main screen you're going to see during the entire time you're doing the mass resuscitation. So if you look at the screen here, this is the rate that you've set, and it's very important to notice that on the rapid infuser, the rates are in mils a minute, mils per minute. Big distinction from what you see on your pumps. If you're looking at 60 mils an hour, that doesn't seem like a lot, but 60 mils a minute is a significant dose. And this machine can go all the way up to 1,000 mils per minute. So you could give an entire liter of fluid over 60 seconds. We don't take it that high. The fastest we like to run would be 700 if we have to, but that's where you'll see the rate that you're setting. This is the actual rate, meaning the rate that it's running. And it kind of has like it's like a smart device. If you set it super fast, it will work its way up to that rate as opposed to just going super fast right away. This volume number will be the entire volume of everything that you've given during your use of the machine. So that includes crystalloid, that includes blood product, that includes plasma. Every little drop that you give will be included in that volume number right there. Here is your pressure line, and it's important to remember that this is here. This machine will only tolerate so much pressure before it will stop the infusion from running. And the pressure that can be tolerated changes depending on the patient access, their vascular status, but the main factor that affects it is the size and length of your vascular access. A dialysis catheter inserted as a central line will infuse at an incredibly high rate with very low pressure versus a 24 gauge in a wrist will probably not tolerate the same level of pressure. So you need to be conscious of this button right here. These two buttons over here, or this number right here, these two buttons over here adjust your infusion rate. You can go up and down as you see fit. And this recirc button right here, this is to be used if you have like an air circulation issue, if you have an air bubble issue, if you've run one of these bags dry and it's beeping at you because it says your bag is run dry, you can plug in a new one and hit recirc, and it will recirculate back through this cassette in the Belmont, but will not actually push any more fluids out towards the patient. All right, so we've called blood bank and we've said we need to initiate the mass transfusion protocol. And if that sounds simple, that's literally what you have to do. If you have a patient and you're not able to keep up with traditionally ordering blood to replace what they're losing, you talk to your docs and you call the blood bank and say, we're going to initiate the mass transfusion protocol, and then you'll give them the patient room number and identifying information. And then at that point, the blood bank is going to start bringing you boxes or coolers of blood. And they're going to continue doing that until you call them and say, okay, stop. We no longer need the mass transfusion protocol. Okay, one of the things we need to be conscious of is that traditionally when giving blood at a slower rate, we're going to use the bridge system to verify each product belongs to that patient. When doing a mass transfusion protocol, we go kind of in an old school way, the way we used to check blood before we had bridge, and that's by using these cards that come attached to each unit of blood that gets sent up. So each box of blood from the mass transfusion protocol will have one of these tags on it. And what you're going to do is find a partner. Now, if you're in a legitimate mass transfusion event, it's going to take 2 people to run this effectively. So you and your partner are going to take your first unit of product out of the bag. You're going to look at this blood card and you're going to go through and check off all of these patient identifiers. So on here is the patient name, the patient date of birth, the patient MRN, and their blood band ID. Very important to have all this stuff on there. And then what you're going to do is one of you will hold this card while the other holds the blood product, and they're going to read off to you the unit number, confirm the ABO row classification of the blood, and then also the expiration date. Okay? And at the point where you're done with that, you will both sign this card, one under transfusionist and one under witness. You'll put the date and time that you started it, and then go ahead and get your blood going. It's important that you put the date and time that you started it, and it's important that you leave this attached to the blood card, okay? Because what you're going to do is say this is a unit of blood. This is going to be attached to the blood. I have filled out the card with my partner. We both signed it, and now it is running at whatever rate we have it running at, okay? When this unit of blood is empty, I'm going to take this blood card off of the blood, and I'm going to put the date and time that blood ended, and I'm going to save this card. Another important thing we're going to need to do is if you're in the middle of a mass transfusion protocol, you're going to need to write MTP in big letters on this card. That lets the blood bank know this blood was given as a part of a mass transfusion protocol. Okay. Another important thing to remember is that there are only two types of blood products that can go through this machine. You can give packed red blood cells, and you can give plasma. Anything like cryoprecipitate or platelets will need to be put in a separate set of infusion tubing and run in slowly. So crystalloid and the two blood products are the only thing that can go through this machine. Another important thing to remember, and a lot of people ask, is how many units can you put through each set of Belmont tubing? The company will tell you you can put as many as you can in over a 2-hour time period. It's not a number, it's a time frame. So once you get this thing up and running, this tubing is good for 2 hours and as many blood products as you need to put in it over that period of time. So just kind of to recap, you're going to check your blood the old school way with a partner, either another nurse or a doctor. You're going to leave that blood tag attached to this blood until the time that part of the transfusion is over. You're going to take that blood card off, you're going to put on there the date and time that it ended, and then you're going to write MTP on big letters on that blood card to let the blood bank know. All right, so we've already discussed what can and can't go in the machine. Let's kind of talk about the order of things, okay? So it's important when we're giving blood replacement, we don't give whole blood in our institution. Really, there's not many institutions that do. So what we do when we replace somebody is we replace them in pieces. We're going to give them a unit of packed red blood cells, we can give them units of frozen and thawed plasma, and then we can give them platelets. And as we talked about, platelets don't go through this machine, but what we want to try to accomplish ideally is a 1-to-1-to-1 ratio of platelet, plasma, and red blood cells to make what amounts to whole blood. So it's important to remember that each bag of platelets that we get represents 6 units of platelets. It's why we refer to it as a 6-pack of platelets. And so it might not seem like we're giving platelets at the same rate that we're giving plasma and red blood cells, but we are. It's just each of those individual each of those individual bags of platelets you get account for 6 units of platelets. If you look on your handy-dandy badge buddy, you will have outlined the various phases of the mass transfusion protocol, okay? And, it's pretty basic. The first phase is 4 packed reds and 2 plasma, and then you basically go 4 and 4 after that with a unit of platelets after every even number. But the trick you got to remember here is that that's a protocol, that's an algorithm. If we're doing this in an actual resuscitation situation, we're going to listen to our labs and we're going to listen to our physicians to help guide us with how to best run a resuscitation. So you're going to give products, if you're doing it without a physician's guidance, which shouldn't really be happening in the ICU, you're going to follow the protocol as it's been written. If you have one of our docs, Dr. Barnes, Dr. Kokenhauer there, or one of the chiefs, and they're telling you, give 2 more units of reds before you do another of plasma, we're going to listen to our physicians and we're going to listen to our labs and manage that appropriately. So it's sort of like ACLS when you're doing a code. All of us that are ACLS certified can run a code per the algorithm. However, when a doctor shows up, they can deviate from that however they want to because they're taking responsibility for the outcome. Another thing to remember is So my partner and I have checked this unit of blood, okay, and it's plugged in and it's transfusing. It's plugged in and running, and it still has our blood card attached to it, right? While this is running, we can go ahead and take more units out of that bag, out of that box of blood product, and check them and have them hanging up here ready to go should we need to give them. And so what you'll do is you'll get them out, you'll go over all of these patient identifiers and product identifiers and then sign here as transfusionist and witness, but you're going to leave the date and time that it was started blank so that you can use it as when you get to the point where you need that product again. So don't waste the time sitting here watching this unit of blood transfuse and not get ready for the next one, because believe me, it will go quick. You'll think you have a minute, but you really don't when you're running pretty quickly on this. So make sure that you're prepared for the next step in the process by having some extra product checked and ready to go hanging here so that you can just take it down, date, time, initial, write MTP on it, and you're good to go. We're plugged into the patient. We have our blood product attached and ready to infuse. Okay, and if you look here, you're going to see our rate is going at 5 mils a minute. Again, remember, it's mils a minute. I'm going to keep going up here. All right, so now that I am up to 20 mils a minute, you're going to see that my temperature is registering here. Okay, this machine cannot warm fluids unless it's going at least 10 mils a minute. Anything less than that, it's just not effectively warming. We have other methods to warm fluid, like the hotline, should we need to run it at a slower rate. Okay, so that's our temperature. And another thing to remember about the temperature, by the way, is that this machine does have a battery pack. You can unplug it from the wall and take it with you if a patient's going to interventional radiology or to the operating room. You just have to be conscious of the fact that it will not warm if it's unplugged. It will only infuse. All right, so I'm going to go ahead and go up on our rate. Let's go ahead and go to 220 milliliters a minute. Okay, that doesn't seem like a lot if you think of it in mils an hour, but that's a significant amount. Okay, I want you to pay close attention to this pressure meter here. It's starting to go up, 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 up. High pressure, okay? In our instance, I actually rolled a roller clamp to achieve this effect, but this is probably one of the most common alarms you're going to run into. So it says, high pressure detected, check patient line for blockage. So when you see this, you're going to need to check your line, make sure it's not under somebody's foot, make sure that the tubing isn't kinked or tucked underneath somebody's arm, and then you're also going to need to look at your access. Okay, so if you look at your access and you see that you're running through a 24, you might need to adjust your rate accordingly. And attached to this Belmont is a card, okay? And on this card, it has kind of a quick reference guide. But one of the things that you'll see in here is a maximum achievable flow rate, okay? And it starts all the way down here at 22 and works its way up. So just be conscious that this company and this machine is acknowledging that it will not work as fast over a small gauge as it will over a big gauge. Big IVs above the AC, central line, cordis, dialysis access are all great for rapid infusion because they are a big fat tube that has a short catheter that can be infused at a high rate. There's also a lot of other troubleshooting things that you'll see on here, but the pressure alarm is one of the ones you're going to run across the most. Okay, so we're up and running, we're infusing into our patient. There's just a few things you need to be conscious of here. You need to watch your clamps here. Obviously, you can have 2 bags of blood or blood products spiked at the same time, but you only want to be running one at a time. And so you want to make sure that the only one of these clamps that is open is the one that you're intending to use while you're running. The other thing you want to be very conscious of is that when someone is bleeding out, we need to be very careful not to give them too much saline. Saline doesn't carry oxygen, it doesn't carry nutrients, it is not a valuable thing to have in your blood, it just gives you volume. So if we have a gap between blood products, you don't want to leave this thing running at a high rate and give someone a liter unintentionally. So always be conscious of how much saline you're giving a patient during a mass transfusion. And one of the ways you can do that is to always be conscious of these clips and don't just leave this one to your saline bag up and open while you're switching back and forth between blood products. As we talked about earlier, while this blood product is running, you can go ahead and have your other one checked and other one ready to go and plug it into your attachment here, and then that way when this one's done, you can literally clamp this one, unclamp this one, and you're ready to go. But remember, leave that blood card on there until that bag of blood product is done. You want to leave it on there until it's done. Then you can pull it off and put the date and time that it ended on there before stashing those blood cards away. And another thing to talk about with those blood cards is during these events, that's literally your only written record that the blood product has been given. So you need to make sure those blood cards are being put in a safe place. Whether that's in your pocket, whether that's in a drawer in the room, wherever you choose to do it, just understand that those blood products are going to be your only documentation, or those blood cards are going to be your only documentation of how much product you've given during this process. And it's very important to remember that, and very important not to be frivolous or flippant with what you do with those blood cards once they're filled out. It's a very big deal to initiate this process, and we need to make sure we're documenting it appropriately for the blood bank's sake. All right, so if for whatever reason you have to open this door during the middle of a rapid transfusion or a mass transfusion, this safety valve down here is going to automatically slide over here and clamp so that nothing is going to the patient while the door is open. And if you look on the screen here, there's a little button that says hold to open valve. It's important that you pay close attention to that, because when I hit this button, it's going to beep and it's going to hold that valve open. If I take my hand away, it's going to immediately close that valve again. So if you have to reattach something here, if this is getting loose, if this little thing has come out, if for whatever reason you have to open this door, you just need to be conscious of that safety valve. It's kind of a last little safety piece of safety equipment here that keeps you from accidentally infusing air or something that you don't want to go into your patient. So just be conscious of the fact that it's there, and also understand that if you do have to open it up, you have to maintain pressing this button for it to stay open, and it's going to beep at you the whole time. All right, so that's the basics of running the Belmont. As we talked about kind of in the introduction, I love this equipment for a few reasons, but for one, this is one of the few things we're going to have in SI that's not monitoring, it's not an assessment thing. This literally can save your patient's life if they're bleeding out. I've been in a situation before where a lady blew her uterine artery, and I could watch her cardiac output drop on her EV1000 until we got this machine running and up going fast enough that we were able to replace what was leaving long enough for her to get a life-saving surgery. So this machine and other rapid infusers can literally save somebody's life. And it's also the kind of stuff that we like learning about in the ICU, right? Like, we sign up to use these things specifically, or we sign up to work in these environments specifically so that we'll be in situations where we have to provide life-saving care. And make no mistake about it, the Belmont can be life-saving care. So it's important that you become familiar with it and understand how to use it. Obviously, this video is just an introduction. It's kind of a down and dirty basics. If you have any other questions about it, or if you'd like to brush up on it, or even get your hands on this tubing, practice loading it yourself, that's something I really recommend, making your hands do the work so that you can understand how to use it in a tense situation. You can feel free to reach out to any of the supervisors. You can also reach out to Amy and Elena, and they can get your hands on some of the educational tubing so that you can practice. But again, basics of the Belmont. It's one of my favorite pieces of equipment, and I hope you learn to like it as much as I do.
Smash that like button.
Smash that like button, people.
Yeah. So whenever you're ready.
All right.